Today, when the world faces the coronavirus pandemic, we have our honorable delegates from their respective nations to assert their views and suggest measures to combat this crisis. I hope this session serves as a great beacon light for a path towards freedom from this ailment. The agenda for today's session is COVID-19. Having said that, let me take this opportunity to introduce Mr. Mohammad Bilal, our Deputy Secretary General. With the powers vested in me as the Secretary General of this session of the Model United Nations, I, Vishakha Agarwal, declare the conference open. May I now please request the Deputy Secretary General to carry on with the proceedings.
Since the roll call has already been taken, we will move towards the proceedings. So delegates, at this point of time, do we have any points on the floor? Any motions on the floor?
Yes, the Delegate of India, you have been recognized.
The Delegate of India wishes to raise the motion to enter into a moderated caucus on the topic, the halt caused by the coronavirus in the functioning of the country, for a total time of 3 minutes, with each individual speaker's time in 45 seconds.
This motion is an order, Delegate. Delegates to second this motion? Any oppositions? Seeing none, this motion clearly passes. Delegates, we are now in a moderated caucus on the topic, the halt caused by the coronavirus in functioning of the countries, for a total time of 3 minutes, with individual speakers' time being 45 seconds. Delegates who wish their names to be added in this caucus?
Delegate of India. Delegate of India.
Delegate of India?
Delegate of China.
Delegate of China. Thank you, delegates. That's all for now. Delegate of India, you have the floor for the next 45 seconds.
India, a third world country, a developing nation, high poverty rate. These are some of the phrases that might cross our intellectual minds when we think about my nation. Still, a deadly virus, a pandemic that ravaged the great nations of a globalized world, has failed to infiltrate the shields of my nation. The mystery lies in deep Indian values. We valued human lives more than the nation's economy and impose a strict, uncompromising, country-wide 21-day lockdown beginning on 24th March 2020. Even when the total number of positive cases across the entire country stood at a nominal figure of 500. We made COVID-19 testing free, even in private labs, by the orders of Supreme Court. This helped us to reduce the per capita impact of the crisis. As of April 21, India had only 13 cases per million, as against more than 2,380 cases per million in the USA. Our state governments have made wearing masks mandatory in the public. We have even started research and treatment through plasma therapy. We are collaborating with the US counterparts to develop a vaccine against this monstrous disease. While the world was in need, India stood up as a true friend to help the fellow nations by supplying the anti-malarial drug, the HCQ, to 53 countries, including USA, Spain, Germany, Bahrain, Brazil, etc. We are using AI-backed software developed by Indian medical scientists in Kyoto for detecting COVID-19 cases across the entire country. During the countrywide lockdown, we have conducted more than 5 lakh tests so far, while the Times Network study said that the epidemic would peak in India by mid-May. We have succeeded in reducing the doubling rate from 3.4 days earlier to 8 days now. The rate of growth in cases has also come down by 40% since April 1. The International Labour Organization said 40 crore workers in India plunge into poverty. But we have taken a calculated step to ensure the world that if it is ever in need, India will always be there to have it back. Thank you.
Thank you, Delegate. Delegates, the delegate from the United States of America was unable to join us in this meeting, so he has sent us a paper. May I now please request the Deputy Secretary General to read out the paper?
Testing for the virus that causes COVID-19 was conducted in Washington and San Francisco state by the CDC using RRT and PCR methods. The Army has been roped, in which it is constructing makeshift hospitals Convention centers and stadiums are being turned into hospitals. We have brought over 80% of Americans under lockdown, as the number of deaths and cases are increasing daily. We have also suspended the issue of new green cards for the next 60 days. 39 states and districts of Columbia are requesting the residents to stay at home except for essential outing to the doctor or for groceries. As the coronavirus spreads, the stock prices have been in a free fall since its peak in February. The sale prices have also plunged down by 17%. We have instructed the Treasury to help and develop a funding plan for the embattled oil producers as the market price plunged to negative $40 a barrel. Thank you.
Thank you, sir. Delegate from the China, sir, you have been recognized.
We were the first nation to have witnessed the pandemic which has been raging in the world. The world's second largest economy has been in the doldrums since it was compelled to enforce a lockdown in an attempt to contain the coronavirus outbreak first detected in the city of Wuhan. Irrespective of the economic threat, we enforced a total lockdown, prioritizing the lives of our citizens. This is both a crisis and a big test for all of us, and we have to race against time, fight the virus, and be back on the track. Thank you, Madam Speaker.
Thank you, Delegate. Delegates, with this, we have elapsed with the time allotted to this moderated caucus. So, delegates, at this point of time, do we have any points on the floor? Any motions on the floor? Yes, the delegate from South Korea, you have been recognized.
The delegate from South Korea wishes to raise a motion to enter into a moderated caucus on the topic steps taken up by various countries to provide medication for this fatal virus and to generate its vaccine to save humanity from a global crisis for a total time of 3 minutes with individual speakers' time being 45 seconds.
This motion is in order, delegate. Delegates to second this motion? Any oppositions? Seeing none, this motion clearly passes. Delegates, we are now in a moderated caucus on the topic the steps taken up by the countries to find medication for the fatal virus and generate its vaccine to save humanity from the global crisis for a total time of 3 minutes with individual speakers' time being 45 seconds. Delegates who wish their names to be added in this caucus?
Delegate from South Korea.
Delegate from South Korea.
Delegate from Italy.
Delegate of Italy.
Delegate from Spain.
Delegate of Spain.
Delegate from Norway.
Delegate of Norway. Thank you, delegates. That's all for now. Delegate of South Korea. Ma'am, you have the floor for the next 45 seconds.
Thank you, Madam Speaker. Out of 5.16 crore people, 10,718 were confirmed cases, out of which 8,635 have recovered. The rapid and extensive tests taken by my country have been just successful in limiting the outbreak of this virus without using the drastic measure of quarantining entire cities. My country first provided the doctors and the medical staff with protective equipment. South Korean hospitals were properly equipped to prevent any chances of infection amongst the doctors and the paramedical staff. When one region ran out of hospital beds, we asked hospitals in other provinces to open up beds. When it ran out of doctors and nurses, we asked doctors in other regions to help. The reason behind our success has been absolute transparency in sharing with the public every detail of how the virus is spreading, how is it evolving, and what the government is doing about it. Thank you.
Thank you, Delegate. Delegate of Italy, ma'am, you have been recognized. You may take the floor for the next 45 seconds.
Thank you, Madam Speaker. A vaccine for general use takes time to develop. Our vaccine may ultimately be instrumental in controlling this worldwide pandemic. In the interim, we applaud the implementation of community intervention measures that reduce spread of the virus and protect people, including vulnerable population, and pledge to use the time gained by the widespread adoption of such measures to develop a vaccine as rapidly as possible. We will continue our efforts to strengthen the unprecedented worldwide collaboration, cooperation, and sharing of data already underway. Thank you.
Thank you, Delegate. Delegate of Spain, sir, you have been recognized. I request you to take the floor for the next 45 seconds.
Thank you, Madam Speaker. We have to take notice because it's a long way to go. The cases in Spain right now are around 200,000 and deaths 23,000. And our nation is the second most affected around the world. We are in this condition because the government was only looking forward for the lockdown and was not looking forward to provide the doctors with the testing kits. The doctors of our nation who save everyone's life have to choose who they let to die and who they save. Because of the shortage of the testing kits and equipment, in a single day, 514 people died, and that is the highest in a day. And now the doctors of our nation are also getting affected by this virus. This all happened because the citizens of our nation were enjoying when the whole world was trying their level best to save themselves from this virus. So I request you to stay at home and not to do the mistake that we did. Thank you.
Thank you, Delegate. Delegate of Norway, ma'am, you are next.
Thank you, Madam Speaker. We are in the midst of a very serious global pandemic. This outbreak of coronavirus disease has created a global crisis and has put a halt to our daily lives. The ground level workers are trying their level best to deal with this virus and to save the lives of people. The ground level team is sanitizing each and every corner of the airport, especially the areas that are frequently touched by passengers. The team is also sanitizing people and their luggages using disinfectant spray. All the passengers are provided with N95 masks as a precautionary measure. Each and every passenger's temperature is also being checked using infrared thermometer. The suspected patients are safely transported to the best healthcare facility where they are tested for the confirmation of the virus. All the staff wears PPE kit as a safety measure. Most important safety measure being put on to contain the transmission of this virus is social distancing. This is very crucial precautionary measure as it will break the chain of virus multiplication. Thus, I urge you all to protect yourself and others during this global crisis by staying at home. Thank you.
Thank you, Delegate. Delegates, with this, we have elapsed with the time allotted to this moderated caucus. So delegates, at this point of time, do we have any points on the floor? Any motions on the floor? Yes, the representative from the World Bank, you have been recognized.
Delegate from the World Bank wishes to raise a motion to enter into a moderated caucus on the topic readiness observed by the agencies of the United Nations for combating the virus for a total time of 3 minutes and individual speakers timing 45 seconds.
This motion is in order, Delegate. Delegates to second this motion? Any oppositions? Seeing none, this motion clearly passes. Delegates, we are now in a moderated caucus on the topic readiness observed by the agencies of the United Nations for combating coronavirus for a total time of 3 minutes with individual speakers time being 45 seconds. Delegates who wish their names to be added in this caucus?
Representative from the World Bank.
Representative from the World Bank.
Representative from the World Health Organization.
Representative from the World Health Organization.
Representative from United Nations Environment Program.
Representative from the United Nations Environment Program. Thank you, delegates. That's all for now. Representative from the World Bank. Ma'am, you have the floor for the next 45 seconds.
Thank you, Madam Speaker. A speeding train jolted, derailed, and halted. This statement in itself is enough to describe the effect of COVID-19 on the life on Earth. This global pandemic has been the cause of a huge downturn in the global economy, which would need a massive redressal. Coronavirus pandemic has been disrupting the global supply chains and international trade, with nearly 100 countries closing the national borders. In the worst case scenario, the global output would contract by 0.9% instead of increasing by 2.5%. The World Bank is taking broad, fast actions to help the developing countries protect the poor. It is deploying about $160 billion in financial support. We need to help people face these enormous challenges and make sure that the financial markets and employers can weather the storm. Thank you, Madam Speaker.
Thank you, Delegate. Representative from the World Health Organization, ma'am, you are next.
Thank you, Madam Speaker. World Health Organization has been on its toes since the first case of COVID-19 was reported. That is, on November 17, 2019. We declared COVID-19 a global pandemic when we realized that it poses a threat to humanity. We got all global trade routes opened for the distribution of essentials like hydroxychloroquine and ventilators after issuing a call with the World Trade Organization. Every day, we work with experts all over the world to collect, analyze, and synthesize the best science to overthrow this pandemic. We have sent more than 70 search teams to various countries to strengthen surveillance and provide advice on medical treatment. I would like to conclude in the words of our Director General. We are all in this together, and we'll only get through it together. Thank you.
Thank you, Delegate. Representative from the World Health Organization. Sir, you have been recognized.
Thank you, Chairperson. Did you know that around 60% of all the infectious diseases are zoonotic, and coronavirus being one of its recently emerged? We are working on an analysis of environment-related risks to pace with field-based industries, including United Nations Development Program, World Bank, and United Nations Office, to highlight how ecosystem restoration can help us achieve environment development, peace, and security objectives. Addressing the COVID-19 pandemic, we require a strong global stewardship and a clear commitment towards building back better. We must keep in our minds that failing to act is failing humanity. Thank you.
Thank you, Delegate. Delegates, with this, we have elapsed with the time allotted to this moderated caucus. So delegates, at this point of time, do we have any points on the floor? Any motions on the floor? Yes, the delegate from Germany, you have been recognized.
The delegate from Germany wishes to raise a motion to enter into a moderated caucus on the topic, the role of media, police, and education in tackling the pandemic, for total time being 3 minutes and individual speaker time being 45 seconds.
This motion is in order, delegate. Delegates to second this motion? Any oppositions? Seeing none, this motion clearly passes. Delegates, we are now in a moderated caucus on the topic, the role of media, police, and education in tackling the pandemic, for a total time of 3 minutes, with individual speakers' time being 45 seconds. Delegates who wish their names to be added in this caucus?
Delegate from Germany.
Delegate of Germany.
Delegate from the Netherlands.
Delegate of the Netherlands.
Delegate of Israel.
Delegate of Israel.
Delegate from Canada.
Delegate of Canada. Thank you, delegates. That's all for now. Delegate of Germany, you have the floor for the next 45 seconds.
Thank you, Speaker Madam. Today, I rise here to voice the contributions of our policemen They're bringing the patients from every corner, not caring about their own health. They're making sure no one breaks the lockdown by standing on the streets all day and night long. They're not seeing their family so that our families are safe. Esteemed delegates, the role played by them is as important as the medical staff. They play an integral role in this battle against coronavirus. And getting through this pandemic without them is practically impossible. Thank you.
Thank you, Delegate. Delegate of the Netherlands, ma'am, you are next.
Thank you, Speaker Madam. Mass media have long been recognized as powerful forces, shaping how we experience the world and ourselves. In the Netherlands, media, through their many outlets, have been extremely useful in preventing mass hysteria by providing facts and figures to back their claims. Doctors and health organizations have been able to address the people through media and give them sanitary advice and safety measures to combat the virus. Media have been an outlet for responsible governments to explain to the people why lockdowns and quarantines are required. Moreover, media persons are working on the ground level, risking their lives as well as the lives of their families to provide real coverage of the outbreak. They aim at highlighting the sanitation workers as the medical staff as the heroes that they are. Through their extensive and intensive coverage of the crisis, they have been successful in shaking up irresponsible governments and making the officials aware of their responsibilities. Media have now become a beacon of hope, with media persons risking their lives for the larger interests of humanity. Thank you.
Thank you, Delegate. Delegate of Israel, sir, you have been recognized.
Thank you, Speaker Madam. Humanity is facing the worst of times. Almost each and every field has been affected by the COVID-19 pandemic, and so is education. As of 21 April 2020, approximately 1.7 billion learners have been affected due to school closures in response to the pandemic. According to UNESCO monitoring, 191 countries have implemented total closures and 5 have implemented local closures, impacting about 98.4% of world's student population. We are conducting online classes so that students' learning process can go on, but still, many of them in rural areas have no proper access to internet. Without proper interaction with peers, there is less emotional, moral, and social development in children. We must accept finiteness, but never lose infinite hope, because no matter what happens or how bad times we may face, life does go on, and it will surely be better tomorrow. Thank you, Madam Speaker.
Thank you, Delegate. Delegate of Canada, sir, you are next.
Thank you, Chairperson. Canada's ability to identify cases early and tracing the source of infection was key to minimizing the spread of coronavirus COVID-19 early on. Canada's COVID-19 Response Working Group became a cabinet committee on March 5. The committee's role is to guide the country's leadership, coordination, and preparedness efforts to limit the health, economic, and social impacts of the virus. In the event that Canada can no longer contain the spread of the virus, the federal government does have a jurisdiction to implement a lockdown under the Quarantine Act 2005. Canadians are being asked to self-quarantine. Canada is taking a right approach in concentrating on slowing the spread of the virus, but it needs to be done in an appropriate and precise way. Thank you.
Thank you, Delegate. Delegates, with this, we have elapsed with the time allotted to this moderated caucus. So delegates, at this point of time, do we have any points on the floor? Any motions on the floor? Yes, the delegate of Iran, you have been recognized.
Delegate of Iran wishes to raise a motion to enter into a moderated caucus on the topic Action Plan to Combat Novel Coronavirus for a total time of 3 minutes and individual speakers time being 45 seconds.
This motion is an order, delegate. Delegates to second this motion? Any oppositions? Seeing none, this motion clearly passes. Delegates, we are now in a moderated caucus on the topic Action Plan to Combat Novel Coronavirus for a total time of 3 minutes, with individual speakers' time being 45 seconds. Delegates who wish their names to be added in this caucus?
The delegate of Iran.
Delegate of Iran.
The delegate from Australia.
Delegate of Australia.
Delegate of Switzerland.
Delegate of Switzerland. Thank you, delegates. That's all for now. Delegate of Iran, you have the floor for the next 45 seconds.
Thank you. Islamic Republic of Iran was the first Middle East country to report a death to coronavirus. This news is indeed in hand by providing coronavirus test kits to Iran. In the country, there are 40 laboratories that have been facilitated to perform coronavirus testing. Rapid increase of death toll across the nation. Tourist spots, tourist places, schools, universities have been ordered to shut down. To handle this worsening condition, the government has also announced a plan to go door to door and disinfect residents' homes. We must keep in mind that we are in this problematic situation together, and we will only be able to get out of it if we cooperate with our government. Thank you.
Thank you, Delegate. Delegate of Australia, ma'am, you have been recognized. You have the floor for the next 45 seconds.
Thank you, Madam Speaker. Ms. Secretary, fellow delegates, ladies and gentlemen, we come together at a point where we face a challenge that goes right to the heart of who we are as nations. A challenge that tests our values, our vision, and our resolve to defend our citizens. The UN Charter sends a clear message to us all to put people at the center of our work, every day, everywhere. And as we face this pandemic due to coronavirus, we have seen the world leaders coming together to take necessary steps required to save their nation and our world. We have seen them saying whatever it takes instead of negotiating for human life. Hence, with constant efforts, unified steps, and international cooperation, we shall win this war. Thank you.
Thank you, Delegate. Delegate of Switzerland, you are next.
Thank you, Speaker Ma'am. Good evening, everyone. The work of essential medical workers in combating the COVID-19 outbreak cannot be underestimated. Doctors, nurses, medical residents, technicians, scientists, paramedics, ambulance drivers, and the list goes on and on. These people are the ones at the forefront of the fight against the virus. The essential workers work hard every day, but in light of this crisis, their work has become harder than ever before. Working all on 3-hour sleeping shifts and going all in to save their patients while trying to protect their families by sometimes not even meeting them for days. These people are doing their duty with utmost honor and deserve all appreciation. Nations have devoted the economy to finding a vaccine for COVID-19 and concentrated its efforts to stop its spread. Special institutions have been set up and have made considerable progress in finding a vaccine for COVID-19. Thank you.
Thank you, Delegate. Delegates, with this, we have elapsed with the time allotted to this moderated caucus. So, delegates, at this point of time, do we have any points on the floor? Any motions on the floor? The executive board is looking forward towards the motion to adjourn this meeting. Yes, the delegate of China, you have been recognized.
The delegate of China.
Seeing none, this motion clearly passes.
I thank all the delegates who are present here. It is indeed a very tough and unpredictable time, but we are ready to face it, and we will surely come out of it soon, as I see delegates working towards making Earth free from this virus.
To have our delegates on one platform and discuss about this serious issue was exceedingly beneficial, as it provided us an insight to the complications faced by the countries and their possible solutions. With the powers vested in me as the Secretary General of this session of the Model United Nations, I, Vishakha Agarwal, declare the Model United Nations Conference closed.